Okay, so thank you again, those who have joined us on Facebook Live, or if you're watching the replay, thank you for joining us, the Arkansas Association of Black Psychology Professionals. We have other people kind of joining on Zoom as we get started as well. So thank you to those who have joined via Zoom. As we move throughout, just be mindful that this is on Facebook Live. We are recording it so we can upload it to our YouTube channel, and we're going to continue just to distribute this content and information probably on our Facebook page, and we did get Instagram as well. We're figuring out how to get things on Instagram too, so we're going to have some presence on both platforms. So just to introduce the series, as you all know, if you've joined us before, we are the Arkansas Association of Black Psychology Professionals, and we started this Mindful Minute Conversation series probably about a year and a half ago at this point, or a little bit more. So today our topic that we're talking about is parental advocacy, a protective factor. So basically what we've been wanting to do with this Mindful Minute Conversation series is talk about topics that are relevant and pertinent to the Black community, and have a conversation in an engaging and educational way where we can bring information, practical tips, tools, and techniques to help people as they navigate all of what's been going on through the pandemic, through systemic racism, relationships, and any other topic that's relevant to Black families, in the Black community. So today we have with us our keynote speaker, our distinguished speaker, Dr. Michael D. Watson. And he has worked with children and families for over 17 years in schools, hospitals, and residential settings. He has a master's degree in both counseling and school psychology. He obtained a PhD in school psychology from the University of Central Arkansas in 2016. He has worked in schools for a decade as a school psychology specialist. He is currently the Behavior Leadership Support Coach for the Office of Coordinated Supports and Service. In his role, he is responsible for providing support in developing tiered behavior systems in level 4 and 5 school districts in the state of Arkansas. So it is just a pleasure to have Dr. Watson here with us today. And I'm just kind of going to turn it over to him. He's going to give us some wonderful information, and then we're just going to have a conversation afterwards about the information that he's presented. So as you come on Facebook Live or as you are on Zoom, please feel free to put any questions or comments in the chat box on Zoom. And you can also be on Facebook and put some information there if you have any questions or comments that could be addressed after he presents. Okay, I'm just going to turn it over to you, Dr. Watson.
All right, thank you, Dr. Holmes. This is honor and privilege to be on tonight. Now that technology has given us access to everybody outside of work, I just want to give a disclaimer. I do have a 6-year-old and a 19-month-old, so you may hear a lot of feedback in the background, but if it sounds chaotic, everybody's okay. Once again, thank you for allowing me to be here this evening. I'm going to share my screen real quick. All right, so just kind of give a background on myself and what I do. So I've worked in schools as a school psychology specialist and a behavior specialist. And my role has given me the opportunity to work along with the district, parents, and then also on the side of the child. So I've had opportunity to work on all three sides of the fence. And that has given me the opportunity to see, different areas where families need support, where districts need support, and then also students when it comes to advocacy. So for tonight, I'm going to spend a little bit of time just going through what a typical system should look like when we're talking about education, both from the academic and the behavior side, when we're looking at intervention, just to make sure that there is an awareness of what those systems look like, and then what happens when there may be a breakdown, like relating to your child or a student having difficulties in academics or behavior. So when we're looking at a typical typical system for academic and behavior supports, what you're going to see is this pyramid. And so with this pyramid, you see that at the bottom in tier one, that's where most of your students are going to be. And then at tier two, you don't want to have a lot of students there because it's going to be, you're going to have to do intervention at that point. And then tier three is when the supports are going to be more intensive and then more just more focused on the child, and it's going to take a lot more hands to get involved. So I'm going to break down each one of those systems for you and just kind of talk about what's incorporated in each system. So when we're looking at tier one, like I said earlier, this is where 80 or 90% of your students are going to be living, meaning that they are receiving adequate instruction, they're in the classroom, they're functioning, both academically and behaviorally. So they're going to have, very few incidents, related to any type of interaction with administration or any problems in class, whether teachers are writing them up or anything like that. So this is where you want most of your kids to be while they're in school. Um, Another thing with tier one is this is where all of your supports are basically doled out to everybody. So when I say that, I'm saying that, they're getting teaching in the classroom, general education setting, or special education setting. It's all the same. They're also probably getting access to some type of positive behavior support. You have your school leadership where they're looking at making discipline data-based decisions. So they're using data to determine how they can keep kids in tier one. You may also be getting some social emotional learning instruction from your counselors, or the teacher themselves may be doing it in the classroom. And this is also where you'll be seeing a lot of screeners and assessments. And so this is where the rubber kind of meets the road, because during the year, you're going to get different reports from your school that is going to say, your kid's going to be tested, make sure they get enough rest, because this is how schools are deciding whether a kid is, making progress at their grade level or if they're going to need assistance. And so these scores that they're getting on these screeners or assessments are going to determine whether this kid needs to stay in tier one or tier two or tier three, depending on the level of support that they need. So this is also the same for behavior, because with behavior, typically what you'll see is students are identified by the number of office discipline referrals that they receive. Also, it could be from a counselor or a mental health agency saying, hey, this kid needs more supports than what you have in tier one. But it just kind of, you want to make sure that when you're looking at tier one, this is where you want all of your students. This is where you want your child to be. And so also with tier one, you may realize that there are 504 students in tier one. There are also special education students in tier one, because they have received the adequate supports that they need to have a typical day just like everybody else. So they can also be incorporated in tier one. So tier two, before we get to tier two, you typically would like to, you want a school district to be able to provide you some type of reasoning why your child was selected for tier two. And it doesn't mean that, the child is not learning, or they're not they're at the bottom of the list when it comes to whatever skill they're trying to train. They're just saying that at this time, your child or this student needs more intensive support, and it's probably going to end up being some type of small group training. So in tier two, you're going to have 5 to 20% of your students. And it's typically need-based. So these students have been identified for a specific area where they have a weakness. And For academics, it could be something like phonemic awareness. On the behavioral side, it could be student has issues establishing rapport with friends, or they have issues with problem solving. And so they end up grouping kids so that they can start providing some type of lesson in a group. And that's typically what tier 2 looks like. Students may also be referred to a tier 2 team. Now, not all districts don't have tier 2 teams, but if they do, and they are referred to a tier 2 team, then what typically occurs in that meeting is that they'll end up having a nurse, a couple of teachers, administration, counselor, and any other type of stakeholders that may be able to give input on different ways and strategies that they can help the child during their time of need. In tier 2, they may also participate in an intervention. On the behavior side, something that is typically used is check in, check out. There's also an increase of incentives that can occur on the behavior side to try to increase the kids' performance or engagement. On the academic side, you're going to be doing more intensive small group work, and it's typically going to be focused on the subject area or the actual skill, typically reading, that the students have shown as a group they're going to need more supports. Also in tier 2, when we're talking about the whole system of education, the Department of Ed has adopted the professional learning community model. And in that model, teachers go through trainings to learn how to use formative assessments, which are your shorter term assessments, and summative assessments to figure out ways to make sure that they're teaching correctly and that they're teaching the right stuff. And then if students don't get it, then what can they do to improve? So there are some great systems out there that the state is working on to ensure that students are getting quality education. But in the event that students still need supports, this is where they would end up. Another area that is looked at in some districts is restorative justice. This is another intervention that can be used. And with restorative justice, it basically gives the student the opportunity to restore whatever problem behavior that they may have exhibited in the schools. Different schools do different things, but the student has to go through like a restorative circle where they talk to sometimes the victim, talk to the teacher, and the teacher gets to tell them how that behavior affected the classroom or affected them. And that student gets that opportunity to have that exchange, and the teacher restores that student and allows that student to come back into the group. But that is another great intervention that's out there being used. And then another intervention that may be used when it comes to behavior or even academics is a referral to counseling, and that could be mental health counseling. If the counselor on the campus doesn't feel like it's an issue that they can help the student with, at that time, students in tier 2 may also be referred to counseling. And so with tier 3, this is where you don't want a lot of students, 1 to 5% of the students. This is where the most intensive and individualized interventions are going to occur. This is where you may have a student that's going to need a functional behavioral assessment, and that's where you actually have a team that gets together and they try to figure out what's the function and why the student is doing what they're doing. And so they'll end up doing interviews with family. They'll do interviews with teaching staff, possibly friends. They'll also interview the student just to try to build a case on why they feel like the behavior is occurring, and then look at ways in which they can prevent the behavior from happening by also looking at different antecedents, things that happen before the behavior or consequences of the behavior, things that happen after the behavior, to determine where intervention needs to occur. So with FBAs, you want to make sure that you use those before a behavior intervention plan is created. And so a behavior intervention plan is going to be specific to that student and is going to include different strategies. It may include reinforcement. It may include individual sessions with therapists, but it's just going to be an individual plan for a student based on the behaviors that they've shown that has deemed them for tier 3. Tier 3 may also result in a referral for special education. And if you look at all the steps we went through in tier 1 and tier 2, and if they're done correctly and the data supports it, this would be a good time to support, to support a referral for special education, depending on, the needs and the committee that meets to determine that. But if you have a good system in place of collecting data, you should have a good process for referral. This may be where students are also referred to what is known as ALE, or alternative learning environment. And sometimes students are placed there for academic issues, also for behavioral issues. There are students that are placed there also for pregnancies, if they're in JDC and they're on their way back to schools, that may be a transition place for them. But this is also an area where students may be referred to ALE. So when we look at this system, this is just kind of a overall view. All districts don't do this and don't have tiered systems set up like this. But in the event that your student does have issues, this is typically the process that districts will follow, unless it's something more severe, like student brings a gun to school, or they have a severe mental health crisis where they've hurt people. That may push somebody up to tier 3. However, if a student has been in tier 1, gone through tier 2, and is still struggling even with all those supports, then they make it to tier 3. That means that the school has done a good job, a diligent job of trying to determine the strengths and weaknesses of that child, but were unable to successfully provide support in the general education setting, and it may result in one of these other options. So I also wanted to kind of give a graphic of what some systems may look like in schools. So if you are in a system where your child is like one of many, where that you're constantly being bombarded by phone calls from the school, that you never can reach anybody, you call to get help and nobody's ever there. This is the type of system that you may be running into in your district or your school. With the pandemic, I can tell you right now, this is where most schools are in this type of pyramid, because we've had so many kids that were out for so long. And so coming back, it's going to look like everybody's in need of some type of support because of the learning loss that occurred due to COVID. But once again, if the school has a good system, they'll probably weed through those tier 2 situations and hopefully get them back to tier 1 or to tier 3, just depending on the need of the student. Here's another scenario where the triangle could actually be inverted, where you have all of your kids at tier 3, well, a bunch of them at least. And so the school is just really they're probably doing everything they can to put out fires because they have so many students in tier 3. So, be mindful of that when you go into the schools. You'll be able to tell what type of interaction they have with the kids. You'll be able to tell what type of system they have in place, typically by the way people interact, also through the communications that you're receiving, emails, any type of apps that the schools are offering to give you the opportunity to speak with the teacher or view the kids' grades, view their office discipline referrals, or any other type of communication where the school district is proactive, then you're in a good system. Lastly, I want to, and when I say lastly, this is not all we're going to talk about, but this is my PowerPoint. I wanted to really kind of touch on some of the qualities that I've seen out of parents that were successful. This is both dual parented and single parented households, where families have had to come in and advocate for their child due to any type of academic difficulties or behavioral difficulties. And these were some of the qualities that I saw out of them that made it a lot easier for them to get the support they need. There wasn't a lot of pushback, and they were also successful at continuing that process throughout their kids' journey through education. So the first letter for advocate is accessible. I've run into a lot of situations where we've had students who may have more challenging behaviors, and we go to look for a contact number, and when we contact that number, the number is dead. And so oftentimes we end up with a child that's possibly going through a mental health crisis, and we could, possibly call 911, get the ambulance there to get involved. But we had a pretty good system in place in the district that I used to work in. But if this was another district and they couldn't reach the parent, that child at that point could have been taken away in an ambulance and end up in acute, all because the parent wasn't accessible. So accessibility, leaving your up-to-date numbers, contacts, also logging into whatever apps the schools offer to give you access to your student to be able to see what's going on in school. Because if you use those apps and the teachers and the school is putting the information in correctly, you'll see a snapshot of each day of that child. So if anything does happen, or when it's time for a conference based on any type of office discipline referrals or academics, there's no excuse if you have access to the app that you didn't know. So be accessible. Also use whatever tools the district provides you to be accessible, because they're throwing you a bone to say, if you use this, then that's our way of communicating. And so you can ask them anything at any time. I have it on my phone right now. I can email the teacher right now and typically get a response back pretty quickly. The D stands for diligent. Having a child in public education, they're going to be there depending on when you enroll them from pre-K to 12th grade. So you've got a long time to be advocating. So you've got to be diligent. But being diligent doesn't mean be abrasive, be confrontational, because if you go into a situation always confrontational, you're going to start to see that people aren't going to want to be in meetings with you. And they will find other ways around having to contact you. So be diligent, but don't be confrontational while you're being diligent. Be visible. Go to the school, go meet the teacher, go meet the principal, go meet the counselor, because you never know when you may end up needing that counselor. You never know when a situation may occur and you've never met the principal, but all of a sudden your son is implicated in something and they were just a bystander. But if you had a relationship with the principal, who knows? The outcome can be different. Be organized. If you are going to advocate, you've got to know your stuff. So the PowerPoint that I've done today is just a snippet of what districts look like as far as when they're looking at intervention. But you've got to be organized, look through the handbook, understand what it takes to hold on, something popped up. Understand what it takes to help your student in a time when they don't have that voice, but make sure you know the policies in the district. Be cooperative. If the opportunity does come up where you're having to meet on your child, understand that everybody there is looking for some type of answer, just like you are. And so you've got to work together and collaborate. So I could have also used collaborate, but you have to. We all need help. And sometimes we look at schools as the enemy, but in actuality, from all of my experiences, I know that the only time we really call is when we need you. And we really need just tell us, if it's something that you've seen before, tell us. Be open, and we'll get to that next. So be amiable, and that's basically just saying being friendly. Um, I know that many parents may have had a bad experience in school, never liked school, and so when you walk into a school, it brings back all those old memories of the feelings you had when you were in school. But we don't want to pass that on to our children. So you've got to change that narrative. Tell them how great school is, even though you don't think it is, because we want them to do better than what we did. So the only way you can do that is by being amiable, being friendly, always being there when they call. When they call, you're polite, you're pleasant. I'm not asking you to brown nose. I'm not asking you to just give up, yourself. But for your children, you should be able to push your pride to the side to do whatever you need to do to help them. Be transparent. Like I said before, if you know little Chris has beat up everybody else in the neighborhood, and he's come to school and he gets into a fight at school, and you're like, I've never seen that before, that's not going to help the situation. And I know that's a bad example, but be transparent. If you've seen some things that have kind of made you think, why is this kid doing this? Somebody at the school may have an answer to help you. Everybody's not out to get all of your business and figure out what you're doing at home. All they're trying to do is help that kid in that moment so that that kid can get back to class and do what he or she needs to do. Lastly, you need to be efficient. Um, in schools, there are so many meetings, there's so many due dates, there are so many fires. So as much as I know administrators would love to, I know teachers would love to, as much as they would love to spend all day talking, to you about your child and all the backstories, make sure you stick to, what you came to talk about and be efficient with it. Because the more clear you are and the more focused you are on what you need assistance with or what they're talking to you about, and you have that information, the better the outcome will be. So that pretty much concludes what I have for today. But I do look forward to dialoguing with Dr. Holmes. So let me stop sharing and open it up.
Yeah. Thank you so much, Dr. Watson. That was great information. I really love that acronym. And maybe I might ask if you don't mind to even share that specific slide. Maybe we can include that on a little as an infographic or something on our Facebook page, just to reiterate those points, because I think those are very important. And I feel like a lot of parents want to be able to advocate for their child in helpful ways. They just need some guidance about how to do it.
Yes, ma'am.
Yeah, so thank you for that. We do have some questions. I want to start with this first one, Dr. Watson, if you don't mind helping us to understand, if a parent is concerned about their child's academic or behavioral performance, like what are some signs that they really need to start advocating in the way? Like what are some signs that it is not just something they can just maybe address at home and maybe punish or not, like they really now need some supports?
So once again, that's where that transparency comes in, and then just also, that communication, being accessible. If you were to go to that teacher, email that teacher, and just express your concerns, typically what will happen is that teacher will go through any type of data that they have to address whatever concerns you have, and then compare it and say, hey, we're already doing tier 2 intervention with this kid. If it is academics, if it's behavior, I would also go to the teacher, because there are chains of command, when you're talking about who do you go to whenever you need support for this. So I would always start with the teacher. If the teacher is unable to give you the answers you need, then I would try the assistant principal. After the assistant principal, then I would reach out to the principal. But normally, if you express your concerns to a teacher, they're going to at least try to communicate back what they're seeing, what data they have. And if that is not enough, then I would send an email back to the teacher and say, I need a little more information. I'm probably going to contact the assistant principal just to get a little more support. Not trying to go above the teacher, but you're trying to get more information.
Right. So maybe they could frame it that way. This is a way of really getting more information. I'm really trying to understand type of thing.
Yes, because you want to be an ambassador for your child. And, ambassadors don't come into other countries and try to run that country. They come to that country, as friends. They're trying to build capacity to understand more about what's going on here to help further their cause. So you have to be like an ambassador, always trying to build bridges and not burn them, because you never know when you're going to need one of those teachers later on.
Yep, absolutely. So starting at the teacher, you say they may have apps and that type of thing, or email. That's the way they can is that the best way these days, like an app or email?
Yeah, because teachers typically can't accept phone calls except for certain parts of the day. And typically, when you call somebody versus like when you have access to like really type something out or write something up, you get that ability to think about it before you do it. Whereas when you're on a phone conversation, it's kind of goes on its own. It's not a lot of thought into it. So I would really stick to using that electronic format. I mean, that's why it's there, for you to have immediate access. I think I just got a message from my kids' school right now. So I mean, that's how open it is.
Yeah, I think that's great. And I see Dr. Moore is on. She's a school psychologist, a member of an organization that also creates a paper trail. Absolutely.
Correct, Dr. Moore.
Yeah, absolutely. So you say, okay, so they can contact the teacher, but you say they need more support, assistant principal, and then if they really need to, then maybe involve the principal. Those are the steps that they need to take.
For more like academic or behavioral issues. Now, if it's if you're thinking it's possibly a mental health issue, I would go to the counselor.
Okay.
And let the counselor talk about what's available in the schools, if they have school-based or if they have some agencies that they have good relationships with that may have established communication with the schools and they have great communication, they may be able to direct you to some mental health programs that they utilize.
Okay. And so I guess hopefully they can start somewhere, because they may not know which is which, huh? They might just know something is going on, their grades are affected, they're acted out, they think they might be depressed. It could be so many different things kind of going on. But somewhere, if they start with either a counselor or teacher or somebody, then maybe they could be directed from there.
Yes, it's all about communication. I would much rather hear it now before it gets to the point where now this student is like not doing any work, head down all day, flipping desks or whatever, when it's something that could have been prevented that you were already seeing at home. So if you're seeing it now, go ahead and make that call and see what we can get done, because you may stop a more severe issue.
Absolutely. Do you mind, you made a statement, had a phrase earlier in some of your recommendation, you said school-based. And if you could just elaborate on what, if people don't quite know maybe what you mean by school-based.
So school-based mental health is where the district has some type of memorandum of understanding with a mental health agency where they actually have offices in the schools. So that's one option. Some districts are now hiring mental health professionals in their schools. So they have the capacity to provide mental health services within the schools. It just wouldn't be through an agency, it would actually be through that district. So once again, if you familiarize yourself with the handbook, typically a lot of that stuff is lined out in like student support services document, or if you're not sure, once again, that counselor is the person to go to.
Okay, excellent. Thank you so much for that. We did have a question, and they were asking about racial or access disparities. So what racial or access disparities have you observed in the referral process among the tiers, and what controls do districts use to address them?
So, I mean, that's an issue I think that we're going to continue to deal with. In part, because of the fact that we do have um, the way the state is set up, and how it's broken up. So, of course, we've got Northwest Arkansas where you have Walmart and, all of the big corporations up there. We have Little Rock, more centralized, that has more access to things. Then you have the Delta, that doesn't have as many resources. And so within all of those different regions, you're going to see different disparities. Because you're also looking at lack of teachers, lack of mental health resources, a lack of jobs. So you don't really have a lot of opportunities for people. So I think we're looking at that more from a social justice standpoint. It's not just education. It kind of encompasses more than that. Because you also have to have opportunities for people to want to get out of poverty, or just to be able to look at education as a path to something greater than something past high school. But the disparities are there. What I typically see is you'll see a lot of Black students referred for special education for behavior. Okay. And so typically, me as a school psych, I'm going to deter a referral for behavior if I see academic scores that are typical to other peers. Because what that tells me is that it's not a disability, it's more of a behavioral issue. And so there seems to be some type of lack of positive reinforcement for that student. We need to possibly build some type of relationship with the family to kind of see what they think about education and where it sits in their point of view. Because once again, quite often I'll run into families where their experiences in education was horrible. And so they're not prepping their children to be ready for that system that they didn't like. Instead, what they do is they reinforce that I don't like it. And so I'm not going to put you in situations where you can be more successful than me. And I'm not saying that's the case for everybody, but I do think we need to take some ownership of it as well. There's just too much out there for us not to be preparing our kids for what public school is going to be like. There are free apps out there, where you can start kids reading as early as 2 years old. Starfall.com is free.
If you want that again, what did you say? Starfall?
Starfall.com, STARFALL.com. I'll put it in the chat.
Okay, and I'll put it on Facebook. Okay,
thank you. It's free. I started my son on it at 2 years old. And I mean, he was ready. You can do, I think it's like $60 for the year if you do decide to do it. PBSkids.org. It's a lot of games, but they're academic. And so instead of them playing some type of race car game or something that's not giving them any type of opportunity to learn, these are things that we could be doing to at least give kids the base that they need, because if they're not reading in kindergarten, it's already over.
Yeah. So what I'm hearing you say is like multidimensional. So with this issue about access and disparities, I'm hearing you say is coming from several places and is several aspects to the solution. So some things we can do for early learning in our communities, in our families. We can do some things to promote readiness for school. In early learning, and set some foundational ways of being prepared academically, behaviorally, and in all ways. But I'm also hearing you say some other things around social justice and what public health talks about social determinants and all sorts of things. But you said something that I felt was key, because you said that if you, as a probably school personnel, somebody in school, had something come across your desk that was where you had to make a decision. I wonder about those decision points. So even after our families, if we do things, go to Starfall, and then you said pbskids.org, all of those things, we can take some ownership. I'm wondering, how can we influence those decision points that people have to make about whether this is behavior, 504, whatever, like what direction am I going to go with this?
And so that's where that advocacy piece comes in, and using all of those those adjectives, because if you have a good relationship, people know you, they're going to be more likely to contact you and say, hey, we're considering this. Or if you considered it, they're going to be like, hey, well, we're not really seeing that. What's making you think that? Or if it does come to a situation when you're in a meeting and you've got 8 people surrounding you that you've never met before because you've never been to the school, it makes the situation a lot more manageable. Because now you're in the room with faces that you know, and they know you, they know your situation. And so that's going to influence the way they think about how they're going to approach the situation. This mom has been here for every parent teacher conference. This mom emails me when I email her and say he did this or that. You got that chain established. So that's what's going to influence it.
Yeah, I agree. I think that advocacy, I'm so glad. Yeah, we're going to share that with the folks that watch the replay and everything. Because when I talk with people at the school, and especially we can have open conversations and with parents, I do try to let them know, please try to maintain your composure and be friendly. Because if you go in guns blazing and they really can have a bias. And especially with parents of color, parents of children, it will be an implicit bias. There will be implicit or explicit, who knows, and it will be something that's activated that's going to now affect their decision that they make about the child based on their impression of you.
That first impression, just like a job. I mean, you don't go into a job, wearing whatever. You wear the clothes that you want to present yourself in for that position. So if you're going to come in and advocate, lawyers have on suits and they're ready. So that's the mode you got to be in. You got to be in a professional mode.
Absolutely. And like Dr. Griffin's point, relationship building, have to build those bridges, build those relationships. Dr. Moore also, I think, is a resource, Intervention Central.
Yes.
You familiar with that?
Yes, that's one that I typically try to send teachers to, when they're looking for some strategies for the classroom. I think there's also some parent links in there as well that they can utilize for creating like reinforcement systems at home to also kind of complement what's going on at the school.
Okay, I think that's great. So I appreciate those in the chat sharing these resources, and Dr. Watson, you put information in the chat as well, because we want when people go back and watch the replay, they'll know starfall.com, pbskids.org, Intervention Central. These are all resources. Let me just ask this question because somebody submitted it, then we'll circle back to other questions if time. What does a parent need to do if their child is being bullied?
So once again, that's a handbook issue. They should have the policy lined out in the handbook. I would review that first, and it should talk about the steps that the school is supposed to take once that bullying referral or whatever they call it, citation is done. And then there are steps that they're supposed to follow to to make sure, they're gonna look at it, investigate, and determine who did what, and they should be able to come to you with the findings of that. But that process should be lined out in the handbook. If not, I will go to the counselor again.
So it really sounds like being involved in the child's education is so critically important. We have to not just receive the handbook during parent orientation or open house and not look at it. Like we have to have that available to us as parents and caregivers and access it and look at it.
Yes.
Yeah.
So I see a question from Dr. Hunter, and she asks, what recourse do you have if no action is taken? So once again, I will go through the chain of command, but then there's also a chain of command through the district level. So, if you aren't getting anything with the counselor, I will go to the assistant principal. Assistant principal is not following up, I will go to the principal, the main principal. If nothing happens there, then that's when you're trying to go to the central office to possibly talk with somebody over student support services. If student support services, if that person's not available, then you have assistant superintendent, and then top superintendent.
Okay. So following that chain of command.
I would.
Excellent.
I would.
Mm-hmm.
Because once again, you're also building bridges. So even if you don't get what you need from that particular conversation, you've introduced yourself. Now they know who you are. And so that opens up the door.
Mm-hmm. Okay. So I see another question. I wonder how many parents know they can call and schedule a meeting with the superintendent. Okay, so that's
and now it's not going to be as easy as, hey, I need you to schedule a meeting with the superintendent. It's not going to happen like that. You're going to have to go through these different people before you can get there. It's just like you trying to talk to the CEO of a company. You've got to go through this process. But if at that point it doesn't work, then you may have to seek some type of legal support. Dr. Karen, I see you laughing at that comment.
So, but if it does get to that point, though, I think parents knowing their rights and kind of knowing,
yes.
I'm assuming like largely we're talking about public schools right now. Now, I'm assuming for parents who are in these faith-based schools or charter schools, does some of this look different, this conversation?
Charter schools have a little more freedom they have a lot more freedom than public schools. So the conversation will be different. But I would say that they align typically with public education when it comes to things like this, because with bullying, I mean, there are so many repercussions that can happen from bullying. So I'm pretty sure they have a stance on it as well, but it's going to be in policy. You need to know the policy.
So regardless of public school, private, this charter, know the policy. And I like Dr. Moore's point, like these people, they're accessible. These folks are accessible. I like that. So, but doing the chain of command and just know that they can be accessed if needed as we go through the chain of command. You mentioned in one of the slides about restorative justice. And if you don't mind reiterating what that is and to help us to understand, like, why do we see that in some districts or schools, but not others? Because I think that's it can be, I see it in trauma-informed schools literature, like it's something that's so helpful about it. So why are we seeing it across different districts and schools?
Well, different districts invest in different programs. Okay. Just thinking about Little Rock has restorative justice. They also have Leader in Me. There's also a program called Capturing Kids' Hearts, but they are all focused on trying to get people to look at the kid first, look at their circumstances, understand that they are a child and that they're going to make mistakes, but then not throwing them away after they make the mistake, but giving them another opportunity to come back and restore the situation, understand how it impacted the people involved, so that they can start to build that empathy and start to feel more of a community. And that's what all of these programs try to do. Restorative justice is just one of those avenues that has shown more promise to inner city kids. And, there's a lot of research and literature out there about it, but it's just one of many. So districts can choose whatever they want. Okay. It's just, do you want it or not? And it's just like everything else. It's something you pay for.
Okay. So when you mentioned, did you say Leader and Me? Is that what Leader and Me, Capturing Kids' Heart?
Leader in Me is a program. There's also Capturing Kids' Hearts. There's a lot of different programs out there. PBIS Rewards is another one that's out there where kids are immediately reinforced for showing positive behavior expectations in the schools. The teachers can scan their ID cards and give them points. And so Earl School District is one of the schools that's actually using that program, and I love it. And they're rocking it using that program. So it's a lot of programs out there, but it's just using it to its full capacity is I think where a lot of districts have challenges because of turnover and just things change. Administrators change, superintendents change. And so that changes initiatives.
Yeah, I can see that. Okay, I guess I'm not going to get all into just my questions, so I'm going to look to see if we have others, because I do think a lot about that. Just what do schools just have? Just basically a social emotional learning
Mhm.
curriculum for just tier one kids, right? Tier one, and then they may need certain special type of things for tier two and three. So as we think about, because you talked about each tier, are
Mhm.
there any type of cultural responsiveness types of things, even for tier one, when we think about your tier one that are that you can kind of just speak to?
So, as far as like cultural pieces being taught in the schools, as it relates to kids relating and understanding different cultures, and I don't see a lot of that. Now, the international baccalaureate systems,
Mm-hmm.
IB schools, that's one of their main focuses,
Okay.
is to focus on people with from different cultures and to appreciate the differences. But as far as curriculum wise, I have not seen anything out there like that.
Mm-hmm.
But I will say, as a state, I know that the Department of Ed, working with Stacy Smith and a few other organizations, they are looking at trying to create a fluid behavior model for the state.
Mm-hmm.
And so that will include trauma-informed practices,
Oh, really?
um, you
Great.
know, full integration of mental health and SEL in the schools.
Mm-hmm.
Also looking at how we can engage the community more
Mm-hmm.
on issues like this
That's
to
good.
kind of get more stakeholder involvement.
Mm-hmm.
So that is something that I am really looking forward to that is coming down the pike.
Okay, that would be great. I like how you said that about SEL, that social emotional learning, that hopefully there's something out there where they're thinking about for all children. How can we teach them like social skills? How can we teach them to handle their emotions where they can be for all kids, not just kids who need more supports, just all
And
kids.
there is a state resource. It's Arkansas Aware. If you type in
Mm-hmm.
Arkansas Aware,
Yeah.
that's out there. And then there's the Guide for Life that's also in that. And what that Guide for Life does is it does break down social and emotional learning curriculums for different age groups.
Mm-hmm.
And so that is being incorporated in some schools, but not all.
Mm-hmm.
But with the intentions of this group that's coming together to look at how we can, have a full integrated behavior system, that will be something that we're looking at in the future, making sure that all districts have some form of SEL in the schools
Wow, that would be
and a
great.
more preventive model
Yeah.
rather than a reactive model to behavior.
Because I wonder if that'll pull a lot more kids down to tier one where they basically have what they need to have more good days than bad days. And you won't have a
Yes,
lot of kids
that's
that
what we
need
want, or to understand that that's normal
Mhm.
because adults have good and bad days too.
Absolutely.
But we seem to forget that when it comes to kids.
Absolutely, absolutely. So when we talk about, I know we just have a few more minutes, but if we could maybe focus on tier two and three for the kids that need those additional supports, are there any like advantages or disadvantages to think about? So if somebody reaches out and said, we really want to refer your kids and we think they need additional supports, be it for academic behavior, whatever the call is about, how should a parent think about that? Like, are there any disadvantages for them to be shifted to that tier two or three, advantages?
So that's yeah. I kind of touched on that on the presentations that it's better to be identified early
Mm-hmm.
than it is to be shot up to tier three
Mm-hmm.
because some systems in schools aren't set up to go through those tiers like that. It's like you do this, you're immediately going to tier three, and I'm sending you off to ALE or to some day treatment program. So
Mm-hmm.
if you have a good system, then it's okay to go to tier
Yeah.
two because now I know that they're going to put my child in small groups and they're going to focus on that particular skill that they need. And chances are, if you are accessible and you are using the data that the teachers are sending home, you're
Mm-hmm.
going to start to see a pattern anyway.
Right.
It's either going to be A's, it's going to be D's and F's or
Right.
C's or whatever. So you'll see a pattern.
Mm-hmm. Okay. Okay. And if you could clarify as you talk about tier two and three, when because it seems like this is some of these like acronym stuff that you use are part of the process in determining tier 2 or 3. So
Mhm.
when you say, maybe let's focus on, you said FBA, a functional behavior analysis. If you could just maybe clarify what that is for our
Mhm.
listeners. Yeah.
So for and there's a functional behavior analysis and there's a functional behavior assessment. And so what
Mhm.
schools do are going to be a functional behavior assessment.
Okay.
And what they're doing is they are trying to determine if the student's behavior is something that can be managed by determining what are the antecedents. So, and for an example, um, if a student is introduced math, so every time the teacher brings out a math book, all of a sudden the student goes and starts to fight with the student.
Mhm.
That's an antecedent, possible antecedent for why this student is exhibiting these behavioral problems.
Mhm.
Another situation could be a student has learned that if I yell out a curse word, the whole class is going to applaud and bust out laughing and
Mhm.
video and put it on YouTube. And so the consequence of that is that attention from the
Yeah.
peers. And so what an FBA will do is start to look at all that data and then determine how can we change this consequence or this antecedent to where we can still give that kid that particular need they want, but
Mhm.
in a more positive way.
Right.
And so that's where their behavior plan will come in because it's going to look at those antecedents and consequences. And then as a team, you're going to try to come up with some way to give them that same input, but once again, more positive.
Right, because they're really trying to look at what's the function of the behavior. What are
Yes,
they getting from it? Where is it coming from? What's keeping it going? And how can
exactly.
we like really work with making this behavior different now that we know this information type thing.
Yes.
Yeah, yeah.
And it is a challenge because you
Oh
don't
yeah.
have a lot of, psychologists. Some districts have school psychs. Some districts do have mental health staff, on board. So you do have that expertise, but then you're also, sometimes you're dealing with people who have no background knowledge of,
Mhm.
really understanding behavior concepts and why kids do what they do. And so that can be a challenge at times, but there's enough research out there. There's
Yep.
enough, they can consult with other districts.
Mhm.
The door is open for them to get the assistance that they need.
Yeah, yeah, absolutely. I'm glad that you said that part, kind of both sides of it, because I know, like, with being a psychologist and working with kids who've had different levels of complexities, I know we could have a team of mental health professionals with some of these kids, and they are just complex. They are layered. They
Yes,
have developmental difficulties plus psychiatric difficulties, social difficulties. It can be hard to tease apart what one behavior means in the context of a bunch. But I'm glad you said there's research and other supports at the same time that school personnel could access. So thank you so much. You've given a lot of information. We could probably have another hour just picking your
mm.
brain on all of what you know. You just have years and years and a wealth of knowledge and experience to share. So we might have to have you on again at some point to talk with us and kind of learn. But thank you for your time today, Dr. Watson and Sharon. We're going to hopefully people will watch the replay, and then hopefully we can share your graphics so people will know ways that they can advocate for their child and be an advocate for their child in the school system, and they can be a protective factor. Yeah, people are saying thank you so much, Dr. Watson. Definitely an excellent presentation. Thank you so much.
No
Um,
problem.
yeah, absolutely. So as people are on, we just want to let people know what's coming next in this Mindful Minute conversation series. So as you all know, if you've been following us, that the first Monday of every month, for the most part, unless it's a holiday, but for the most part, the first Monday of every month, we have this Facebook Live where we bring people on and discuss these very important topics. So Monday, November 1st, we're going to talk about resilience in the face of trauma. And our panelists are going to be Dr. Reverend Laverne Bell Tolliver. And then we also have Reverend Judge Marion Humphrey, who's going to talk with us again about resilience in the face of trauma. And the moderator is going to be Dr. Pat Griffin. In December, on December 6th, we're going to have the topic is going to be about the blues, childhood depression. So we're going to have somebody who's going to come on, who's an author and they wrote a book on this topic, Gail Holmes, and we have as the person, our moderator, or as our clinical psychologist guest is going to be Dr. Karen Moore. So we thank her. She's come and she's been on tonight as well in our chat box, but we will look forward to having her on in December. So thank you again, Dr. Watson. We appreciate your time. Thank you to all who's joined us live. And everybody have a good evening. Thank you. Bye-bye.